Men over 50 often notice changes in their bodies, but they don't always pay enough attention to them. First, there's the frequent urge to urinate at night. Then, a slight discomfort in the pelvic area that seems harmless. Over time, the discomfort increases. This could be a sign that your prostate is reacting to what you do, or don't do, on a daily basis. Masturbating every day can have a direct effect on the prostate, but the impact is not as obvious as many think. While some believe that this practice can cause problems, others argue that it can be beneficial. What really happens when this becomes a daily habit? The answer lies in balance. The frequency with which the prostate is stimulated influences its health in various ways, from circulation in the area to the risk of inflammation. The issue is that most men only realize the consequences when symptoms start to appear. Ignoring the function of this small gland can lead to problems, but understanding how it responds to your habits can help prevent future discomfort. This is one of those topics that few people talk about, but it makes a huge difference in men's health. Before continuing, make sure you're subscribed to the channel to follow more content on health and sexual education. If this video provided you with valuable information, hit the like button so more people can access it. Leave your opinion in the comments. Type 1 if you approve of the topic or 0 if you have suggestions for improvement. Your participation makes all the difference. Many men go decades without even thinking about their prostate until something unusual starts happening. That was the case for João, a 65-year-old businessman who ignored subtle signs for years. Slight discomfort when urinating, a feeling of heaviness in the pelvic area, and the urge to go to the bathroom at night that became more and more frequent. When he finally decided to seek help, his prostate was already enlarged and causing urinary retention. Could he have avoided this? Yes, but like many others, he didn't know the essential role of this small gland. The prostate is a walnut-sized gland, but it has a huge function. It contributes to the production of seminal fluid, which is essential for fertility, but its importance goes beyond that. Over time, this gland can undergo changes, and lack of care can lead to problems such as inflammation, enlargement, and even severe urinary difficulties. The problem is that many men only realize this too late. It's common to believe that symptoms appear suddenly, but the reality is different. Small discomforts can be signs that something isn't right. The constant urge to urinate, a weak urine stream, and the feeling that the bladder never completely empties, all of this could indicate that the prostate needs attention. Maintaining prostate health doesn't require major sacrifices. Small habits make a difference, and understanding how this gland functions can help prevent future problems. What few people know is that some common daily practices can directly affect the prostate, and one of them has a greater impact than you might think. Do you want to enhance your sex life and strengthen your relationship? In the digital book, Rediscovering Intimacy, Healthy Sexuality, After 60, you'll find practical tips to rekindle desire, overcome physical and emotional challenges, and enjoy more satisfying moments. Access the link in the first pinned comment and discover how to transform your love life. The prostate is an active gland that constantly produces essential fluids for the reproductive system. The problem begins when this fluid isn't expelled frequently enough. Think of a water pipe that goes unused for too long. The flow becomes compromised, residues start to build up, and when you try to use it again, the passage is no longer as clear as before. Something similar happens with the prostate. This retention can lead to an accumulation of secretions that, over time, become thicker and harder to eliminate. The result? Increased risk of inflammation, a feeling of heaviness in the pelvic area, and even discomfort when urinating. Many men only realize something is wrong when they start experiencing daily discomforts. In my clinical experience, I have seen cases of men who came to the office complaining of constant bladder pressure, believing it was just a urinary issue. After tests, it became clear that the problem was in the prostate, which was congested due to a lack of regular fluid elimination. This also affects blood circulation in the area. When fluid accumulates for too long, tissue oxygenation decreases, and the prostate can start to undergo structural changes. Small daily habits make all the difference in keeping this gland functioning well without unnecessary strain. The interesting thing is that there are natural and simple ways to prevent this stagnation, and some of them can have positive effects not just on the prostate, but on the entire body. Prostate function is directly linked to hormones that regulate various functions in the male body. One of them, DHT, dihydrotestosterone, plays an important role in reproductive health, but in excess, it can contribute to prostate enlargement, a common problem with aging. What many don't know is that ejaculation frequency can influence these hormone levels and, consequently, prostate health. During ejaculation, there is a temporary reduction in DHT levels. This process can act as a kind of relief for the prostate, preventing prolonged exposure to this hormone. In other words, regular activity can help maintain hormonal balance and minimize the risks associated with prostate growth. This was observed in clinical studies comparing men who maintained a moderate ejaculation frequency with those who had long periods of abstinence. The results indicated that regular elimination of prostatic fluid, besides reducing the accumulation of secretions, can have a positive effect on regulating male hormones. Another relevant aspect is the improvement in overall well-being. Many men report that maintaining a balanced frequency leads to reduced stress, better sleep, and even more energy throughout the day. This happens because ejaculation releases endorphins and promotes relaxation, factors that directly impact quality of life. The issue is not just about frequency, but balance. Excessive activity can lead to fatigue, while a lack of it can overload the prostate. Understanding this mechanism can make all the difference in maintaining male health over the years. For a long time, talking about prostate health was almost a taboo. Many men grew up hearing that certain habits should be avoided without understanding the impact this can have on the body. The result? Thousands of men over 50 suffer from prostate problems that could have been prevented, but they avoid seeking information or treatment due to shame or misinformation. One of the most common myths is the idea that after a certain age, certain practices no longer make a difference. Some believe that as the years pass, the prostate simply works on its own, without the need for maintenance. But studies show exactly the opposite. Men who maintain a balanced routine of care have a healthier prostate and a lower chance of developing urinary discomfort. Another widely spread misconception is the belief that any prostate enlargement is a serious problem. Prostate growth is a natural part of aging, but that doesn't mean every man will experience complications. The issue arises when this growth is accompanied by symptoms that affect quality of life. Shame also plays a harmful role. Many men, fearing social judgment, avoid discussing the topic, neglecting their health. It's not uncommon to find patients who only seek help when symptoms are already advanced, making treatment more difficult. Breaking these taboos and seeing prostate health as part of overall well-being is essential. Reliable information and proper habits make all the difference in maturity, ensuring more comfort and quality of life. Prostate health is directly linked to how often it is stimulated. But what is the ideal balance? Excessive stimulation can cause fatigue and overload the body, while prolonged absence can lead to fluid buildup and increased inflammatory risks. The key lies in moderation, respecting the body's signals, and adjusting frequency with age. Studies indicate that men in their 40s tend to have a more active and resilient prostate, allowing for a higher frequency without significant negative effects. After 50, a more moderate rhythm is recommended, around 2 to 3 times per week. By 60, regularity remains beneficial, but without excess. Maintaining a proper routine is more important than increasing frequency in an uncontrolled way. The case of two 55-year-old brothers illustrates this issue well. The first maintained a balanced routine, avoiding excesses or long periods of abstinence, and had normal prostate exams. The second, who avoided any form of stimulation because he believed it could harm his health, ended up developing urinary discomfort and an increased PSA level. Small adjustments in his routine quickly improved his symptoms. Beyond frequency, blood circulation quality and hydration also affect the prostate. Lack of fluids can make secretions thicker and harder to eliminate, increasing the risk of inflammation. Keeping the body hydrated and adopting balanced habits helps the gland function without strain, providing more comfort and quality of life over the years. The connection between prostate health and overall well-being goes far beyond what many imagine. Keeping this gland functioning properly not only prevents urinary discomfort and inflammation, but also brings positive effects on sleep, mood, and even daily energy levels. Many men notice significant changes in their bodies and minds when maintaining a balanced routine. One of the main benefits is improved sleep. Sexual activity, including ejaculation, releases substances like prolactin and oxytocin, which help the body relax and promote deeper, more restorative sleep. This can be a major advantage for men who struggle with insomnia or wake up multiple times during the night. Additionally, stress reduction is a natural effect of this process. The release of endorphins and dopamine provides a sense of well-being and relaxation, reducing anxiety levels. Another often overlooked benefit is the impact on self-confidence and daily energy. Men who maintain a balanced sexual life report having more motivation for physical activities, better concentration, and even increased enthusiasm for daily tasks. This happens because sexual activity regulates hormones and improves blood circulation, benefiting the entire body. The key to enjoying these benefits is balance. Excessive activity can lead to fatigue, while complete absence can cause tension and fluid buildup. Maintaining a routine that respects the body's signals and combining it with healthy habits can have a positive impact not only on the prostate, but on overall quality of life. Prostate health is directly linked to daily habits, and ignoring this can lead to consequences that many men only recognize when symptoms appear. The frequency of prostate stimulation, hormonal balance, and even blood circulation directly influence well-being and quality of life. Small adjustments make a big difference in preventing discomfort and keeping this gland functioning well over the years. Now tell me in the comments, did you already know that ejaculation frequency could impact the prostate this way? I'd love to hear your thoughts. If this video provided useful information for you, hit the like button now. Your like helps YouTube recommend this content to more people, helping more men better understand their health. And if you want to keep learning about this topic, watch this other video on the screen now. There, I go even deeper into the subject and provide essential information for male well-being. Take the opportunity to subscribe to the channel to follow more content on health and sexual education.